Okay. I have 6 o'clock even Pacific Standard Time. Okay. Open office hours. Just fix this mic real quick. All right. So open office hours for my practice, Well Woman MD. They're at 6 p.m. Pacific Standard Time every Tuesday. They're webinar format featuring either a topic or a guest. Last week I had Lori Shu from OC Herbs and Acupuncture on. She talked all about what we do, what can we use acupuncture for as far as the hormone world. And so I'm going to have a holistic nutritionist come on, another OBGYN. I have a couple guests coming up in the summertime. At 6:30, there's a facilitation. So those that are members in my practice, actually, we hop on a Zoom call and basically you can ask whatever you want. We can chat about different topics. Sometimes we've talked about the presentation, and sometimes we've just talked about the latest information. Like we talked about intermittent fasting one time, and it's just a way for the people in my membership to essentially get questions in between their visits, because in the membership they get a 60-minute visit and then they have weekly open office hours to hop in. Again, open office hours, if you join them for the membership, they are voluntary, they are confidential. We try to be respectful of other people. We try to be non-judgmental and just make sure that we're allowing people to be open to asking questions. They are not recorded for that reason. So I do not record open office hours in my membership because I want people to be able to feel free to ask questions and there's no need to record them from that standpoint. So rules, again, I send an email to my members and just remind them that we have open office hours. If you want to submit a question for me to specifically answer, you can actually do that online if you just want me to answer it in this kind of webinar format. Or if you're in the membership, then I'll answer that as a hot seat question. And then that's the Q&A that I mentioned. So why am I doing this? I think it's really important to get the information out there, and I really want people to feel like there are other people that are going through the same thing that they are. And I feel like sometimes when you're going through a lot of health concerns, you don't feel like there's anybody else who understands you or gets you. So this allows people to, in the group format, to be able to really ask questions and see what other people have experienced. Maybe something worked for them. They can make suggestions to other people. So this is sort of this comes up, I say this frequently, and I really do feel like the model of healthcare should involve your health visits with not just your doctor, but your chiropractor, your acupuncturist, a lot of different venues, community participation. So women teaching women to just, so we can understand what works and what doesn't work. And then ongoing learning is what I'm doing today. And also courses are another way to get ongoing learning. So PCOS and weight gain. I decided to cover this topic, and this is not extensive because this topic is huge, because frequently the women that I see in my practice, weight gain is a big issue. They're frustrated by gaining weight. They're frustrated that it's hard to lose weight and just feel like, that it's an uphill battle. So I wanted to cover some of this topic. Again, it's so incredibly complex. It's hard to cover that topic. So why is it that people get frustrated? Well, because a lot of times they're told to eat less carbs, exercise more. Their friend tried keto, they lost 30 pounds and it doesn't work for them. And they don't understand why it didn't work for them. Or they're being told, you know what, you need to try harder. That maybe if you tried harder, you would be able to lose weight, and that it's really, success is up to you. And I think this is really, really destructive thinking for women with PCOS, but also scientifically it's incorrect. There is no data to support women who eat, like if you, just eat less carbs and you exercise harder, you're going to lose weight. Now, there is some data that's supporting keto diet, but really that data is looking at women who have diabetes or pre-diabetes, and it has been shown to be very effective for catalyzing or getting started on weight loss. And certainly can be a great thing for maintenance. But as far as just sort of overall eating very few carbs, long-term sustainability, there is no data that supports that women with PCOS should do that, that's the way to go. So this is really kind of flawed, the way that we are told as women with PCOS that you lose weight. So we're going to go a little bit into sort of what I think what my approach is, but why I think it is. So again, weight gain and PCOS is really complex. So I want to mention this. I said this last week when we were talking about 4 hormonal causes for weight gain. And again, let's talk about the connection between hormones and fat. So there are different types of fat. There's white fat, brown fat, and white fat and brown fat, and beige fat, which is in between. So white fat is really where you have storage of glucose. This is what we use for like fast energy if you need to quickly run away from the bear. It's what surrounds your organs and underneath your skin. Visceral fat is included in this category, and that's the fat that's around your organs. White fat has sensors for multiple hormones, such as insulin, different estrogen, progesterone, and testosterone receptors, cortisol, and it secretes a lot of hormones. It's actually, that type of fat is actually in the pathway for sort of our metabolism and what's set as our metabolic point. And then and the reason why it's important for PCOS, because high levels or low levels of estrogen can affect not only storage of fat, but also what hormones are being released. And then the other hormone that I frequently mention when I talk about white fat is leptin. So leptin is the hormone that says that I'm full, I don't need any more food, I'm full. But in PCOS, often women have abnormal levels of leptin, and they also have leptin resistance, which leads to them craving more sugary foods, sugary beverages, because it provides fast glucose, which makes you eat more because you want to be able to get that in as quickly as you can. And then you store more of that glucose as fat because you're not needing it. You're not running from the bear. So ultimately you end up storing it as fat. And again, you can determine sort of white fat composition if you use a BMI calculator, fat calipers, or there's these new scales, and they're not new, but relatively new, that allow you to sort of see body composition in different areas of your body. Brown fat is thermogenic fat. So this is what the fat that we burn. It helps with our body temperature. It has a higher number of mitochondria, which are those little powerhouses in the cells, which help you with creating energy. It's also the type that you want to burn, that you want to use it so that you can set your metabolic point higher. It is affected by exercise, sleep, magnesium, circadian rhythms, and also women who are trying to improve their brown fat will often sort of not only focus on lifestyle modifications like stress and sleep, but they'll often add magnesium and then a good sleep hygiene routine. And then beige fat, again, is in between brown and white fat. And what it has to do with these hormones is we're talking about sort of weight gain in PCOS. And so I've heard people tell me before, patients who said, I have a PCOS belly. And this term is sort of it's an unusual term, but there is some reality behind it, because women with PCOS often gain weight in their lower abdomen, kind of like a pooch, or call it PCOS belly, because it's deposited underneath the skin, but also in the visceral fat. So it kind of gives this picture of sort of a lower abdominal outpouching. And visceral fat, or fat that's inside that coats your organs, is really where you see the data that's linked to higher rates of diabetes, heart disease, stroke, high blood pressure with women with PCOS. It's really what we try to aim to decrease, so we can decrease your long-term risk of these complications. So one thing I often say to patients is it's actually not your fault that weight gain is so common with women with PCOS and so hard to lose. It's in fact your hormones. It's not your fault. It's not like you're doing something specifically wrong. It's an imbalance in your hormones. And usually these hormones that we are referring to are your androgen levels, your insulin levels, and cortisol, because they all lead to inflammation. In fact, most chronic illnesses are really inflammatory conditions. They increase the inflammation in your body, and your body responds to them. And that response is the signal, or those signs and symptoms that you feel, like brain fog, weight gain, hair loss, difficulty going to sleep. All of those things are sort of signs and symptoms of your body being out of balance. So I talked about this last week, but insulin, is the hormone that's main job is to send glucose into the cells for energy. It's sort of the knocks on the door and says, please let this sugar go into the cell so it can be used to make energy. And insulin resistance is fairly common in women with PCOS. In fact, some people even say every woman with PCOS has some variety of insulin resistance. And ultimately, this can lead to weight gain, cravings, inflammation, and more. Cortisol is the main hormone, our stress hormone. Again, it's the fight or flight response where, if we're under threat, cortisol helps us to escape that threat, to deal with that threat. And then androgens, the main two types of androgens are DHEA and testosterone. And then leptin I mentioned already. So the thing is so complex about PCOS is without sounding negative, it is sort of a downward spiral. You get hormone dysregulation, so your estrogen, progesterone, testosterone ratios are off. You also get insulin resistance, and this all leads to inflammation and just constantly each one is making each other worse. So when you have more inflammation in your body, then you get more insulin resistance. When you have more insulin resistance, you get more inflammation. It's just this constant spiral that makes it difficult. And when we look at this, so then we need to basically kind of look at those three factors: the androgen levels, the hormone dysregulation or the sex hormones, and then cortisol. So high androgens, the hallmark of PCOS is high androgen levels. And really where the dysfunction is, or the dysregulation, I use these words dysfunction, but dysregulation is really that androgens need to be converted to estrogen. And there's a an enzyme called aromatase, which converts androgens to estrogens. And in the ovaries, the testosterone that's made is actually converted into estrogen. And there are different types of estrogen. In PCOS, these abnormalities not only occur in the granulosa cells in the ovary, and that leads them to actually make less aromatase, and they also respond poorly to FSH. The low estrogen, because they're not making as much estrogen, so that enzyme is sort of not working appropriately. This leads to low estrogen because those androgens should be converted to estrogen, but they're not. And so then you get high testosterone, low estrogen kind of picture. And the low estrogen causes the brain to say, well, I must need to make more because I don't have enough. And so it tells the brain, just make more. If we make more, then we're going to get more estrogen. Well, that higher and higher and higher production of testosterone causes also those estrogen receptors to be kind of dulled to the response of estrogen to begin with. And so these things all compound upon each other. Not only do you make more testosterone than you need, it's that testosterone is not adequately being converted to estrogen, and then those receptors are not receptive to the estrogen that's there. And you see this in how the body responds to that state, that high testosterone, low estrogen state, because it causes less insulin to be produced effectively, and then you get insulin resistance. You also have improper communication in the liver, so it's not actually being broken down appropriately, which leads to the liver to store fat as opposed to burn fat. And then oftentimes the low estrogen state in the bowel can cause these inflammatory bowel conditions like IBS, IBD, SIBO. And so really it's this sort of dysregulation or not the appropriate ratio of estrogen, progesterone, testosterone that leads to these symptoms that people feel, like weight gain from insulin resistance, like having difficulty with brain fog, like having digestive issues, having hair loss. All of these things are really related to this imbalance. I presented this slide last time, and it is a very busy slide. Actually, next time I should probably zoom in on what I'm talking about. But here's testosterone. It needs to be converted to estradiol. And again, the enzyme is aromatase. Of course, there are three forms of estrogen: estrone, estradiol, estriol. And I should have used the correct term instead of saying the word estrogen. It's just sort of easier sometimes to understand the bigger concept. So this needs to effectively happen. But this is where that dysfunction in the granulosa cells in the ovary that occurs. Insulin resistance is also a key factor. So high androgens, high insulin. So insulin resistance, which I've mentioned before, is really when the cells are supposed to be opening up to allow the glucose to come in and then being used effectively. Well, if the pancreas is always secreting insulin over and over and over again, not only does it produce it improperly, but then also is secreting so much that the extra sugar essentially overwhelms the system. And so the signal is just not being seen. So oftentimes the cell says, well, I already have too much. I don't need it anymore. And you develop insulin resistance. And I've talked about this before. So high insulin levels can not only cause you to have more storage of fat, but also it leads to higher levels of leptin, which is that hormone that's supposed to say, you know what, I'm full, I don't want to eat anymore, but it doesn't. It becomes resistant as well. And it leads to cravings where you think that you're hungry, even though you really aren't. And so then you eat more food, and of course, that extra sugar gets converted to fat. So it really is this sort of vicious cycle that's sometimes hard to break. This is why women will often say to me when we're working together that the cravings can be some of the hardest things to break, because it's a signal that your brain is telling you that I think I need to eat more, but ultimately that is not the case. It's just that hormone dysregulation. So inflammation is the last part, and this is due to all of those things I just mentioned. So high cortisol levels, the stress hormone, high insulin or insulin resistance, and high testosterone. All of these things lead to inflammation. And this is, and then there's a lot of other things that do cause inflammation separately, like toxin exposure and stress. So all these things can kind of compound on top of each other, making waking difficult. So some of the steps that I use. So I want to talk a little bit about some of the steps, but really what I do is try to do a really personalized approach to that specific patient on what is actually causing their weight gain. So the first step that I always start with is knowing your numbers. So knowing your numbers. So I mentioned that the 3 hormones that we're really focusing on is insulin, the sex hormones like androgens, testosterone, and DHEA, and inflammation or cortisol. So you really need to know your numbers. You have to get tested. If you don't know this information, then how are we supposed to aim for what we need to fix those hormones that are imbalanced if we don't actually know the numbers? So you should definitely have insulin resistance testing done once a year. If you're suffering from weight gain, you're having weight gain issues, then you should have it more often because you want to see if your numbers are improving. And that includes things like hemoglobin A1C, which I'm sorry, I did not put on that slide, fasting glucose, fasting insulin, and your lipid profile or your cholesterol levels, because you want to know what is your level of insulin resistance. How much are you having a difficulty breaking down the sugar appropriately? So just as a maintenance, women with PCOS should be getting a hemoglobin A1C, fasting glucose, fasting insulin, and cholesterol. But certainly if you're having issues with weight gain, you need to know where are you on that spectrum. Inflammation can often be measured by CRP and also nutrient deficiency. So getting a vitamin D and vitamin B level are really important because oftentimes people have nutrient deficiencies because they're not absorbing the nutrients from the food, which then causes them to not make the hormones. You need those nutrients to make these specific hormones. You can also do a lot of functional medicine testing for inflammation. So you can look at toxin exposure, you can look at heavy metals, you can look at a lot of other things, which oftentimes we will do in practice just to see what is causing someone's CRP level to be elevated, because CRP is not specific. It just says there's inflammation in the body. It doesn't really tell you where it's from. And then hormone dysregulation, you want to know, I mentioned how testosterone and DHEA can be high and estrogen can be low. Well, you want to know what are the numbers? Like, do you have an imbalance in those hormones? Those can be done by blood tests, but they're just not as good as saliva testing. I personally believe the saliva testing is better for looking at specific hormones, so estrogen, progesterone, testosterone. And then if you're looking for like the balance, the Dutch test, the urine test can often be very helpful, but it's done in the second half of the cycle. So it's done after day 19, but sometimes it can get you valuable information if you feel like you're breaking down. Like, so for instance, if your estrogen is not being broken down appropriately and your progesterone level is low, then sometimes that can give you more valuable information. So there are a lot of different ways to test this. In the traditional office, cortisol levels, or the stress hormone, is done by 8 a.m. cortisol level. And that's just the test that we have. You can also do a 24-hour urine test, but it's just not as this first test that's always done as an 8 a.m. cortisol level, because that's when your cortisol, your stress hormone, should be the highest. But again, those can be all done through saliva testing or urine testing in a functional medicine perspective. So I'm not going to focus on, so we just talked about first step is always knowing your numbers. Know your numbers, because then you know how to, A, are they improving? And B, what do you need to focus on first? Because it is a complex issue. I'm not going to talk about how to fix or the treatment for hormone dysregulation, this one, because it's so, because this topic would be really big. So we're just going to focus on the insulin resistance piece. But I did want to mention kind of things that we typically do. So if we find out that, say, your estrogen is low, your testosterone's high. Often, if you, in the traditional sense, they give you a birth control pill because the goal is really to lower your testosterone level, to lower it so that the estrogen progesterone that's given in the pill can then give you a very set amount every single day. So every day is exactly the same. Now, there are women who still have symptoms despite being on the pill, and that's because it doesn't address your estrogen level. What's in the pill is a very low level of estrogen and progesterone, of course, synthetic estrogen and progesterone. And so it doesn't address that factor. So if you're someone who has weight gain because your testosterone level is really high and your estrogen level is really low, you might notice that it didn't really fix itself even with a pill. So that's one thing that I often talk to patients who are on it and say, I'm still having weight gain issues. Then we need to talk about how we can fix that hormone dysregulation if that's what the levels show. You can do it more naturally, and this is the treatment. And that's why I want to do a separate presentation on, because it's so much to talk about. So reestablishing your circadian rhythm will help you lower your testosterone level naturally and raise your estrogen level. And really, it's been shown to improve anxiety, depression, digestive issues, fertility issues. If you want more information about this, there's a great book published by my friend Felice Gersh. It's called PCOS SOS. And it talks all about establishing your circadian rhythm is your normal 24-hour clock, and how you can not only eat, but also sleep to that circadian rhythm to get yourself back in sync. And it's really, really good book. Again, PCOS SOS by Dr. Felice Gersh. It's Gersh. Fantastic book talking about circadian rhythm and how to sort of reset your clock. But I do want to focus on insulin resistance, because majority of women have insulin resistance who have PCOS, and majority of women find that this is really the cause of their weight gain or difficulty losing weight. So there are a lot of medications that can help with insulin resistance. Most people are familiar with metformin. It's actually a diabetes drug that we often use in a dose that's lower for women with insulin resistance. And it can help that insulin resistance piece. It does lower blood sugars, and it is frequently used for women who are trying to get pregnant to help augment Clomid, which is a medication that's used to help with ovulation. That is pretty much the standard when we talk about traditional options for insulin resistance. But in the alternative, I don't want to say the alternative, but the integrative medicine world, we often use inositol, berberine, or cinnamon. All three of those, and the other one is gemanine, sorry. And all of those are really, really great options for controlling your blood sugars and for managing your blood sugars, instead of having this sort of roller coaster effect that sort of keeping them on a more natural balance. I frequently will use inositol with patients. I think it's actually a very effective medication. You want to make sure you have a combo of D-inositol and chiro-inositol, so that usually it's powder form, although that comes in tablet too. You can look on the back and just make sure it has a combination of both. Berberine is also a fantastic medicine, very, very well used in Eastern medicine for balancing blood sugars, and cinnamon. But one thing to note, I know I've seen patients who've used supplements called blood sugar support. You do need to make sure that you're not combining too many things at one time, because you can lower them, you can get them too low, and then you're dizzy, weak, shaky, you just feel bad. So make sure that when you start any of these sort of blood sugar managing medications, that you really, keep an eye on the symptoms that you're having and just do one at a time. Most of these do not have interactions with other medications. In fact, I've had a patient before who had metformin and inositol both, but you need to make sure you're doing this under the guidance of a provider so they can make sure your sugars aren't too low. I'm not going to get too much into those medications because, again, this is really specific. And I really think that medications are meant to really start the process to get you going with lowering your blood sugars. But ultimately, food is medicine. And that's really what you want to do. You want to be, I prefer, and I know a lot of the patients that I see prefer to really be able to manage it without medication. So we want to talk about food as medicine approach. How can you lower your blood sugars and decrease insulin resistance without medication? So I'm just going to talk about a few little concepts here. The first is timed eating. So I mentioned that the gut has different bacteria in it called the gut microbiome. So there are different types of bacteria that help break down the foods that we eat. But they also have a clock or a master clock, just like your circadian rhythm. So your body tells you it's time to go to sleep and it's time to wake up. That's your part of your rhythm. But the gut also has bacteria that sort of has this clock that sort of sync to the clock. And it also helps, the gut bacteria helps set the clock for the liver, the intestines, the pancreas, all of these sort of digestive system organs. And it knows what time it is by when you're eating and when you're fasting. So when you're eating and when you're not eating. And so it's really important if you want to sort of balance your blood sugar so that say you don't eat something and you get this big spike in glucose and then a spike in insulin to deal with the glucose, this sort of roller coaster effect that a lot of people have, then you need to sort of work on trying to improve your gut. And the way you can do that is timed eating. If you have a gut that's in sync with the normal master clock, then you'll actually have a normal metabolism. Your liver will help detoxify or get rid of waste products, and then you'll have healthier digestion. Based upon research, the ideal time of fasting is between 12 and 13 hours. And I don't like the word fasting because then people get confused with intermittent fasting, which is very different. Intermittent fasting, like you're actually using fasting as a biohacking technique to help lose weight or to maintain weight. And oftentimes intermittent fasting comes in ratios of like 16 hours of fasting, 8 hours of eating, or 24 hours on, 24 hours off. So it's a little different, the word intermittent fasting, but really the reason why I'm using the word fasting is because it truly means not to eat. So most people have a normal set metabolic rate that's dependent on their gut having a time to rest and digest and a time to actually be actively breaking down food. And so research shows that the fasting window, the time where you're not eating, should be about 12 to 13 hours. But most Americans don't do this. Most Americans eat till 8, 9, 10, and then they wake up at 6 for work and then they eat. They often don't do a normal 12-hour window where they're not eating. The other part of timed eating is really having time between meals. So having an actual time to digest that food, break it down, absorb the nutrients from it, allow the gut to rest. We're sort of prone to snacking. We've sort of developed, and me too. I have this habit of sort of knowing it's 3 o'clock, it's time to reach for a snack, but it can be very detrimental to trying to maintain a normal blood sugar balance during the day. If we're always eating and having these blood sugar spikes, we need to really have this consistency. So some of the tips for timed eating are make sure you have a 12-hour fasting window. So finish eating by 7 or 8, and that allows you to eat in the morning at 7 or 8. Make sure you have a window of time that you're not eating, so your meals are spaced out every 3 to 4 hours. And then eating within 1 hour of waking. I've mentioned this before. Women with insulin resistance, their sensitivity or their insulin sensitivity is the highest first thing in the morning. So skipping breakfast is like the worst thing you can do. And then eating a breakfast, making sure that you're eating a solid breakfast that will sustain you, will often then set you up good for the rest of the day, especially if it's one that has a high protein content. It'll actually help keep you full so you don't find yourself snack. And oftentimes, the most common thing I see when I see patients is they'll often tell me they skip breakfast, they don't eat anything till 2 o'clock, and then they're just eating till 10 o'clock, which is it just doesn't sync with what you should be doing with the microbiome in your gut. This data is actually based upon a couple of things. There's a great study in the Nature journal, and also there is a lot of good data looking at what is the order of how you should eat. Does the order of like when you eat fat, protein, and carbs, does it matter? Will it help you balance your blood sugars by eating foods in a certain order? And there was a great study that took patients, and they said gave them the same exact meal. And they said, I'm just going to make this up. So here's chicken, salad, and piece of toast. I'm just making this up. They actually had them eat the carbs first, then they had them eat the protein, then they had them eat the fat. They did a postprandial, or 2 hours after they ate blood sugar, and they looked at what their blood sugar values were, and they had them, and so they did that. They ate the same meal for lunch for 7 days straight and looked at their blood sugar. Then they reversed, and actually for the next 7 days, they ate the carb last. So they had the veggies first, the protein next, the fat next, and the carbs. And they looked at their postprandial blood sugars, and they're in the exact same meal. 7 days later, nothing changed. They monitored it for 7 days, because what they were trying to do is make sure that it wasn't like, oh, you were super stressed out or something happened, but trying to sort of have the average of what those blood sugars were. And overall, eating in a certain order lowered those men and women blood sugars by 26%. And there's actually, and so looking at this information, what they were trying, these were women and men who had diabetes and who were on metformin. So I should say that, because they are diabetics and they are monitoring their blood sugars consistently anyway. But the reason why it's so important is because when you eat your non-starchy veggies or your vegetables, those are your prebiotics. They have a lot of fiber. And so what they do is not only coat the stomach, but they also, by coating it like that and the intestines, they actually help you slow down the absorption of the glucose from your carbs. So it turns even carbs that may be considered sort of fast absorbing carbs into slower absorbing carbs, so that over that meal, you're slowly getting this glucose into your blood system, and it's slow. The pancreas goes, okay, I need to secrete this much insulin in order to deal with this much sugar. And it's a more gradual process that helps you manage those blood sugars, as opposed to what most people do. In fact, the reason why I thought this was really interesting, there's a really great person you can follow on Instagram. Her name is Glucose Goddess. And what she does is just, I think, fantastic. What she does is she actually has a continuous glucose monitor, and she also uses regular glucose monitors. And she shows what happens if you say, eat a waffle, and then you eat a waffle. So she shows her blood sugar chart, and then she'll say, okay, I'm going to eat the same waffle, and I'm going to have it with protein on it. So like peanut butter on it. And she shows the difference in what happens on your blood glucose spikes. And obviously this is related to insulin as well. And you can see how much it matters, not only what the order of what you eat, but also what you eat with those carbs. And it's fascinating because it makes sense. Like if you have fiber that's going to sort of cause the absorption of this sugar to be slower, then you're not going to have this huge spike in sugar and then your body responding to these spikes. I thought it was fascinating. She did a great podcast interview recently, and she was talking about the way that if you own a restaurant, you want people to eat bread, right? You want to put bread on the table because you want to give them carbs and alcohol, carbs and sugar first, because that instant, quick sugar that goes into the blood system will cause you to crave more and eat more, because your body says, oh my gosh, I just got this glucose hit. I want more. Like, I want to do this. I want you to eat more. So I thought it was kind of interesting. It's kind of fascinating when you think about sort of how we structure things at restaurants, or structure how we eat. So the order of what you eat does matter. So non-starchy veggies first, they have high in fiber, protein next, fat next, carbs last. And remember, not all carbs are the same. The carbs, everything has carbs, but like vegetable carbs is a very different carbs than, let's say, wheat bread. So I didn't get into the details there, but that also is a component as well. Oh, this is what I just mentioned. So why eat in a certain order? The fiber and the veggies slow the absorption of the carbs. Slower digestion of carbs cause a slower it doesn't cause a blood sugar spike. It actually causes more of a gradual increase in your blood sugar. And then also it doesn't cause leptin, which is that hormone that's released from the fat that says, hey, I'm full. You don't have this spike that leptin is sort of confused and says, I should eat more. So this is the second concept. So we talked about timed eating. We talked about the order in which you eat things. And now the other component with insulin resistance is making sure you pair your carbs with fat and protein. And this is where that Glucose Goddess information is so amazing. is she often will compare carbs, or naked carbs, she calls them, versus carbs that are paired with protein and fat. So if you're going to have your waffle, I'm not saying not to eat your waffle. I'm saying make sure that it's paired with fat and protein as well. So oftentimes people will put peanut butter, like I said, on a waffle, or I'm just using waffles because I'm thinking about the highest carb thing. It could be anything that we're talking about, but making sure you're always pairing fat with protein. This is something that I talk about, that balanced plate. In fact, I have a freebie that you can download that talks about sort of the ratio, what your plate should look like. And so it's really about sort of pairing your carbs with fat and protein. So it's slowly absorbing these over your meal and after your meal. The last concept I'll talk about related to insulin resistance is your carb tolerance. So knowing how many carbs you can tolerate, you can eat without causing weight gain, is a really cool biohack when it comes to PCOS. So some people can tolerate 80 grams of carbs a day. Other women are 100 grams. This is how knowing your carb tolerance is really, really important. And if you're not if you're eating too many carbs, then you'll often have those symptoms of shakiness or brain fog, cravings, afternoon slump, feeling fatigued. Those are sort of that, blood sugar imbalance symptoms that people have. So there are a lot of different ways to figure out your carb tolerance. Some people start with a keto diet and they say, okay, I'm going to start with the lowest amount possible, so 20 grams of carbs, and I'll build up from there to figure out how many I can tolerate to where I'm not feeling hungry in between meals. I'm not feeling brain fog. I'm not exhausted. And other people just start on the average. So the average sort of PCOS diet is 45% carbs, 35% fat, 20% protein, and they'll kind of adjust from there and figure out what is their personal carb tolerance. So for example, for me, I usually aim between 85 and 100 grams of carbs. And if I eat too less, I get kind of cranky. If I eat too much, then I often am wiped out in the afternoon. I just can tell I just don't have the same energy and I feel like I want to eat more. So knowing your personal carb tolerance is really, really important. There are other ways to do it on a faster scale. If you don't want to have to sort of trial and error and figure this out, these continuous glucose monitors, I think, are amazing. They actually go on. You can, let's see if there's a picture right there, but here's the monitor basically, but it actually goes onto your arm or like the back of your arm, and they continuously tell you what your blood sugars are. And the way that people use them, there are several companies. I put Levels as one of them, and then Freestyle Libre is another one. It gives you real-time information. And what's cool is you can actually figure out what foods you can and cannot eat. So you might find that you have sweet potatoes, and sweet potatoes don't cause you to have a blood sugar that spikes, or sweet potatoes might cause you to have a blood sugar that spikes. I think it's a really good, useful tool for trying to figure out what foods can you tolerate and what foods can you not. You want to aim for a fasting blood glucose of less than 90, or after you eat 2 hours later, you want to have a blood glucose that's less than 120. Some people, I think these are really great. I hope that they're getting more and more popular and people are able to get them easily, but they are kind of expensive. Like the Levels one I know is a couple $100. This one's, I think last time I checked last time I had a patient on it, it was like $99 for a month, which isn't bad, but they can get kind of expensive. The other way you can do it is, if you're going to try to use your insurance, is you can actually get a glucose monitor, but you're going to have to prick your finger, and you're going to have to do that several times in order to actually get the blood glucose value. But they can be covered by insurance if you're using a diagnosis code like insulin resistance or prediabetes. There's a couple different ones. But those are really the faster way to sort of get the information to find out, where are you? What can you tolerate? What foods cause you to have a spike in your glucose? There we go. So I didn't mention about hormone dysregulation and inflammation, but I just wanted to quickly say, because these are things I should talk about separately, is all about adrenal gland and how adrenal glands affect your blood sugar balance and affect your PCOS symptoms, and then reducing toxin exposure. So the last step that I mentioned, so knowing your numbers, finding out the cause and addressing that cause. And today I talked about insulin resistance specifically, but the third step when we talk about trying for weight gain is also optimizing those hormones. Once you figure out what's imbalanced, then you want to not only, get them in balance, but you want to optimize them. So the way you sort of take it to the next level is you also talk about stress management and gut health. So I always put this slide at the end because I think it's really important to know for people who don't know what an integrative approach is. We really spend a lot of time on the visits in 60 minutes going over everything you've tried, not tried, good history, what's worked. We do a lot of testing, not only using normal traditional labs, but also functional medicine testing. I've mentioned the Dutch test a couple times. And then trying to find a personalized plan for you that's actually incorporates both diet, lifestyle, stress management, herbs, supplements, and kind of knowing what is causing you to have these symptoms, because I really want you to be able to manage them and figure out how to know your body so that you can get what you need. So, okay. So I want to just in summary say that, the most important part is to get tested. Make sure you get tested and know what are your numbers. What is your hemoglobin A1C? What is your fasting insulin and glucose? What is your CRP level? Have you had your female hormones, your sex hormones tested? Because that's really important information to know. If you maybe some of what the symptoms in the weight gain is related to your progesterone being super low and your estrogen high, or your estrogen really low and your testosterone high. What is the actual hormone dysregulation? And then if you're focusing on insulin resistance, which off the bat, if you don't want to get tested, there's a good shot that insulin resistance is causing some of this weight gain, then you can work on timed eating. So not eating 12 hours, a fasting window of 12 hours and spacing in meals, making sure your carbs are not naked. So they need to be paired with protein and fat. Figure out your carb tolerance. How many carbs can you eat per day that doesn't cause you problems with not only symptoms of blood sugar amounts, but also weight gain. And then really knowing what foods work and don't work for you. I think, like I said, those continuous glucose monitors are really very cool and provide really valuable information. And I think they're going to become on the marketplace much more popular to be able to use. Okay, I know I keep trying to make this 30 minutes, but I guess I talk too much. You probably make less slides. Okay, so we're going to pop those that are members in my practice. We can pop over to the Zoom link and talk about whatever questions you have. And certainly if you have any particular topic that you want me to discuss in these open office hours, you can shoot me an email or post it in the Facebook group. Either way. And yeah, I'll head over to the Zoom. Have a good night, everyone.